President Trump has announced the launch of TrumpRx.gov. It's a new government website meant to help Americans use their own money to buy prescription drugs. TrumpRx does not sell medications, but it allows Americans to search for certain drugs and to buy them directly from manufacturers or from pharmacies. Unveiled last night, the site, the president says the program will deliver the lowest prices and save Americans money. But critics warn many consumers, especially those with insurance, could end up paying more by going outside their coverage, since most of the drugs listed are already widely covered. Joining us now, FDA Commissioner Dr. Marty Makary. Dr. Makary, great to have you back on the show. So for people who just kind of discovered this last night, heard about it, what is the market for this? Who are you steering toward? Because if people have insurance, obviously they pay a low copay and they can get these drugs for much, much less expensive than they would buying them directly with cash. So what is the market? Who are you targeting here?
Well, first of all, the copays and deductibles are going up each year in healthcare because no one has been able to control the out of spiraling costs. And so what you're actually seeing is a phenomenon in the United States where the cash price is below the copay. And remember, pharmacy benefit managers, or PBMs, which is an arm of the insurance companies, have many shell games to skim money off the top. So by going direct and buying the drug from those who make the drug, this is ushering in a new era in healthcare. TrumpRx is the beginning of a new chapter in American healthcare, where for the first time you can buy the drug from those who make it, because those who make it have been complaining about the many middlemen in healthcare that have been siphoning billions out of the system. And this has been my area in health policy research when I was at Johns Hopkins. The amount of money games that go on with healthcare's middlemen, which is a function of the complexity of the system, are unbelievable. And so you've got 40 drugs on TrumpRx right now. That's going to increase. Some of these drugs are the highest spend drugs in the United States. Some of them are not covered by insurance. And hopefully insurance is going to evolve and change their coverage decisions to allow people to get a better deal, because they would be saving money.
So, Mr. Commissioner, beyond this, the FDA also this week involved in an announcement about food coloring. This is something that's been a priority of the health secretary. Can you explain to us what is now going to change, like for I go to the supermarket tomorrow, or when this goes into effect? What will that now look like for me when I go to the shelf?
Well, first of all, when you see that label that says no artificial colors, that's not been accurate. Now it's going to be accurate, because we are enforcing and changing the definition to allow natural colors to be included in foods that say no artificial colors. We approved 2 natural colors yesterday. That's 6 so far in the 10 months that I've been in office. That's more than in the previous 5 years. Normally, the FDA would approve 1 every couple of years. We want alternatives to the petroleum-based artificial dyes that are molecules that don't appear in nature, that are reacting in the gut of kids, and they've been associated with behavioral disorders. And guess what? We have a behavioral disorder epidemic in the United States in children.
So why are these allowed at all? I mean, artificial dyes, it seems like it isn't food okay the way it looks, as opposed to in these bright Day-Glo Technicolor hues. That's all for marketing, right?
That's right. We don't need glow-in-the-dark Fruit Loops. And if you look at these American companies that are making, say, cereals, for example, they make 2 versions. One for Canada and Europe, where the petroleum-based dyes are not allowed, and one for American kids. So we have banned one of the dyes. We're looking at the others. But we convened the companies to say, can we appeal to the best in people in America? Turn off the social media echo chambers, put the phones down, look at each other in the eyes and say, this is a crisis in America. Ultra-processed foods, these petroleum-based dyes, making junk food more attractive to kids. And so they said yes. They said voluntarily they are going to remove the petroleum-based food dyes. You win more bees with honey than fire sometimes, and that's been a huge success.
Well, that's where I wanted to ask you lastly, is that what is the enforcement mechanism here? What if there is a food company that's just like, actually, no, we're not going to do this. We like the neon colors.
Yeah,
what
so
do you do?
The vast majority of companies have said yes. Giant companies, ConAgra, General Mills, Kellogg, Pepsi, Nestle, giant companies people said would never do this. there might be a holdout group. We have said we're going to use every tool in the toolbox in terms of our regulations and enforcement, and the science is continuing to accumulate. When that gets more mature, we have more leverage.
FDA Commissioner Dr. Marty Makary, thank you very much for coming on the show this morning. We appreciate it.